Hi, my name is Dr. Jesse Schulz. I'm a physical therapist in Mukwonago, Wisconsin, and I've been a physical therapist for 8 years.
And I'm Joanne Jessen. I'm also a physical therapist in Mukwonago, Wisconsin, and I've been a therapist for 35 years.
We're making this video today to help both our patients and anyone else who's more interested in the rehabilitation process and recovery after total knee replacement. We're going to be covering the details of how to sleep a little bit more comfortably during the night, management of pain and swelling, the recovery process, and long-term management of your knee after this. We hope you enjoy the video. Thank you for watching. Before you've been discharged from the hospital or before you've been discharged from a surgery center with the total knee replacement, you've probably heard of the risks of getting a DVT, PE, or joint infection. A DVT is a deep vein thrombosis or a blood clot in the leg. A PE, pulmonary embolus, is a blood clot that's found its way to your lungs. Any of these conditions are ones that you should be monitoring yourself for during the rehabilitation process to make sure that you don't have any serious complications.
The signs and symptoms of a DVT would be calf pain, a rapid change in swelling, which would include firmness of the calf, tenderness of the calf, and heat in the calf. Some or all of these symptoms may be present.
For a PE, you may have signs or symptoms of pain in the chest, shortness of breath, fatigue, and a general feeling of not being well. However, typically after this surgery, most people do not feel well, either because of the trauma from the surgery itself or from being on the pain medications. But if you do think you have a PE, you should dial 911 immediately because it is a life-threatening emergency.
The signs of a joint infection would include redness, heat, swelling, a low-grade fever, and possibly drainage from the incision.
If you think you may have any of these conditions, you need to contact your physical therapist, your surgeon's office, or your primary care physician's office immediately, because a DVT, if left alone for too long, could turn into a PE, and a joint infection can spread. Swelling and pain are very common after a total knee replacement surgery. Managing swelling and pain is very important for the success of your rehabilitation.
Swelling and pain are related. If you let the swelling increase, your pain will increase and you will lose range of motion. You should spend some time every day with your leg elevated above your heart. If you're on your feet too much or your leg is in a dependent position for too long, you will have increased swelling. Every week you should notice some improvement in swelling.
One of the most common ways to manage pain and swelling after your surgery is to elevate your leg above your heart while you're laying on your back, applying ice to the knee while doing gentle ankle pumps where you're pumping your ankle or moving your ankle up and down while also doing quadriceps setting or gently squeezing the top thigh muscle. Light massage, if performed from the ankle to the thigh, can also help with fluid and swelling management of the leg. About 2 months after the surgery, you should notice a significant improvement in swelling and pain. But if you still are having swelling and pain, this is still common, and it will gradually improve over the next 12 months. If you pressure yourself to be on your feet, walking, or standing for too long a period of time, this is variable from one person to another with how long is too long a period of time. If you don't manage the swelling and pain immediately afterwards, it may take 2 to 3 days to recover. The CPM, or continuous passive motion machine, is something that you may have after your surgery. Many people find it helpful for managing swelling and stiffness after their surgery. If you don't have one of these machines, many people still find it helpful just to be spending the extra time on their feet, walking around, standing, getting stronger, and also doing their home exercise program with the time they could have been in the CPM machine.
Initially, when getting in the CPM, you want to decrease the range of motion from the last setting when starting your new session. You will increase the CPM when you are no longer getting a stretch. You are always trying to get a light stretch when in the machine.
It's important to have a goal for what range of motion you're going to achieve in the CPM machine, but don't perceive this as your limit for the day's session. If you anticipate that you'll be getting to 95 or 100 degrees, but you can get there easily, try to push yourself further. Depending upon the swelling and the pain that you have that day, you may be able to go further than you initially thought. However, do not use the CPM to do aggressive stretching of your knee. The main reason for this is generally a lot of people compensate or kind of move their hip or their back to try to get an extra few degrees from their knee, and this generally is not helpful. Try to spend 4 to 6 hours per day in the CPM machine if you have one.
Initially, when you go home from the hospital, you'll either sleep in a recliner or your bed. For more comfort in your bed, you can position a pillow lengthwise under your leg for support. Typically, it takes about 2 to 4 months before you're getting 6 to 8 hours of sleep.
Loss of sleep and knee pain and aggravation can be emotionally wearing for a lot of people after this surgery. Use of pain medications and sleep aids, pending your doctor's approval, are helpful. If you are still having problems with being upset after this surgery and having a hard time being satisfied with daily activities, feel free to try to participate in some activities that you normally enjoy, and also possibly using guided meditation to relax and manage your stress. Don't forget that you've just had a major surgery when you've undergone a total knee replacement. It should take about 12 months to recover after the surgery. Some surgeons even say it takes about 2 years.
At 3 months, you should be feeling pretty much back to normal. You should be able to shop. Typically, you can walk without an assistive device. You should be able to be back to work. Stiffness can continue to be a problem with prolonged positions, but your swelling should be much better.
At 6 to 12 months, you should have much less noticeable pain, swelling, and stiffness, and it should be gradually improving if you still have any of these symptoms. We want you to be happy following the completion of your total knee replacement rehabilitation. But the ultimate goal is for you to feel that your knee is working at its best for you for the rest of your life. This is not your natural or original knee anymore, and some maintenance may be required. Many people find that they feel better if they do 30 minutes a day of walking, biking, or aerobic exercise in the water.
Your recovery is individual to you. Not everyone wants to play tennis following a knee replacement, but some people want to do more than walk or shop. It's easier to participate in activity if you maintain full range of motion. You will also find there is less stress on your knee with full range of motion. Some people find regular stretching helpful.